Today I'll introduce you to the autopsy, and I'll talk about the first part of it, which is the external examination. So let's get to it. An autopsy can be performed if suspicions arise during a death investigation. It can not only determine the manner of death, but also the cause of death. And pathologists are the medical specialists that are trained to look for evidence that supports the manner of death. We are going to be doing a pig autopsy in our class. Why are we doing a pig autopsy? The anatomy of a pig is similar to human anatomy, and the organ systems will be completely removed and studied, and it's fun. So you'll be conducting a fetal pig dissection using the protocol for human autopsy to determine the cause of death for the pig. An autopsy has 7 general steps. The first is external examination, then the Y incision, then removal of organs, then we look at stomach contents, then we collect samples, then we examine the head and the brain, and then we put together a conclusion. We will be taking on the role of a forensic pathology lab. In our lab, our job is to perform autopsies on dead humans. We will be using fetal pigs to represent our human bodies. And over the next few days, we'll be going through this process of performing an autopsy. The first step is the external examination. An external examination autopsy is a visual examination of the body to determine the cause and the manner of death, if possible. It is a key part of the autopsy process and is performed before any internal examinations. External examination is defined as a detailed description of the decedent's remains, including scars, surgical incisions, medical devices, tattoos, etc. No internal cuts are made on the body and no organs are examined yet. The body is examined for signs of trauma, such as scars, bruises, or cuts. It's examined for unusual markings like tattoos or distinguishing marks. It is examined for natural diseases like jaundice or edema. It's examined for identifying features such as clothing or medical devices. It's examined for changes in skin color. The body is also examined for lividity or blood pooling to help determine the time since death. And the purpose of the external examination is to establish medical diagnoses, provide facts for the judicial process, and serve the public interest. And it can provide information that helps determine the cause and manner of death. The external examination is documented in a written report and with photographs. The written report includes details like scars, tattoos, and the body's overall condition. The photographs include images of the body's external surfaces, clothing, and any pertinent findings. There are 4 roles that will be taken on. The prosector is the forensic pathologist that's conducting the autopsy. The diener is the prosector's assistant. The materials manager is responsible for the instruments and supplies. And the recorder records all the information for the autopsy report and takes photographs. The recorder's hands stay clean. They don't take part in any of the actual autopsy. Just some general procedural notes. You need to wear gloves, goggles, and lab aprons. You'll be using scalpels and scissors, and those need to be used with caution so that you're not cutting things you don't want cut. If you're just exploring, it's better to use a blunt instrument. Don't perform anything you have not been assigned to perform. Don't do the job of somebody else. Most importantly, if you are not using an instrument, put it down. We want to avoid waving scalpels around or scissors so that we're not cutting other people. You're going to be working in lab groups. You want to make sure all your materials are ready before you get started. Put on your protective gear, organize your area. You'll be placing an absorbent pad on the dissecting pan to absorb liquid, laying out your instruments so that you can access them, and then just kind of go over everybody's roles so everybody knows what they'll be doing. Here's a picture of what you'll be getting. You'll have the dissecting pan. You'll have an absorbent pad that you'll open up and put in the pan. You'll have some pins. You'll have gloves. You'll have a big bag that you're going to put the pig in when we're done. You'll have dissecting tools. You'll be cutting open the bag that your pig comes in. You'll put that absorbent pad in the tray, then remove the pig from the bag and put it on the absorbent pad. One of the first things you're going to be doing is determining the sex of the pig. You'll do this by looking for the urogenital opening. On a female pig, this opening is located near the anus. On a male pig, the opening is located near the umbilical cord. So here's the urogenital opening on a male pig. On the female pig, it's going to be back here. If the pig is female, you should also note that urogenital papilla is present near the genital opening. Here's a male pig. You can see that urogenital opening right there. Here's a female pig. You can see the urogenital opening here on that genital papilla. So for your external examination, the body is going to be weighed and measured. The external features of the body are examined for unique markings or injuries like birthmarks, injuries, discoloration, any other kinds of markings, and all of that's going to be written in your report. You're going to take photographs and then complete procedure A in your student guidebook.